Hi moms, I'm Dr. Kaylee and I'm so glad you're here today. You know that feeling when your little one's up at 2 a.m. crying from ear pain and you feel completely helpless. I see it in my practice all the time. Exhausted moms who have tried everything from countless rounds of antibiotics to sleepless nights holding their crying babies upright, just hoping for some relief. If you're watching this, chances are you're at the point where you're tired of hearing, oh, it's just another ear infection. Oh, don't worry, they'll grow out of it. Or here's another round of antibiotics to try. Or maybe you're even worried about your child falling behind in speech development or facing a decision of do we do tubes, do we do surgery? I want you to know you're in the right place. So today we're gonna look at ear infections in a whole new way. I'll show you why they keep happening, what's really going on behind your child's ears. It's not what most people think. And most importantly, how we can help your little ones find long-lasting relief without endless antibiotics or surgery. By the time we finish our chat today, you'll understand exactly what's going on to cause those recurring ear infections, and you'll also have clear, practical steps you can do at home to help your child. No more guessing or feeling stuck with limited options. I'm here to help and show you that there is hope for breaking this exhausting cycle. And so if you're ready to learn more, let's dive in. Okay, let's explore an important distinction that can help you better understand your child's ear infections. While it's true that ear infections are common, affecting about 80% of children before the age of 3, this frequency doesn't make them a normal part of child development. This understanding is crucial because it helps us recognize that recurring ear infections often signal underlying issues that we need to address. When we examine the anatomy of a child's ear, we find 2 key structural characteristics that contribute to their susceptibility for ear infections. First, children have eustachian tubes that lie in a more horizontal position, unlike a vertical position that we see in adults. This horizontal positioning is actually normal development. As your child grows, their facial structure elongates, these tubes will gradually shift into a more vertical position. The second important feature is that children's eustachian tubes are narrower than those in adults. These tubes serve a vital function. Really, they help drain fluid from the middle ear and maintain proper ear pressure. When they're narrow and more horizontal, fluid doesn't drain as effectively, creating an environment where infections are more commonly likely to develop. However, this brings us to a critical point. If these anatomical features were the only factors causing ear infections, we would expect every child to experience them regularly, but we don't see that pattern. Many children never develop ear infections, and we actually see this all the time with kids in the office that are under consistent chiropractic care. This tells us that anatomical structure alone isn't the complete story for ear infections. What we're actually seeing in cases of reoccurring ear infections is often a sign that your child's immune system and drainage mechanisms are not functioning properly. Middle ear infections, known as otitis media, are what most parents think of when they hear ear infections. And that's what we're going to focus on today. These infections occur in the space behind your child's eardrum where fluid builds up when drainage is not working properly. This is quite different than an outer ear infection, which is swimmer's ear, which is a completely different part of the anatomy being affected with different causes, and we're not covering that today. So middle ear infections come in 2 forms, bacterial and viral. This distinction is particularly important because it directly impacts treatment effectiveness. Bacterial infections can respond to antibiotic treatment, while viral infections will not. Unfortunately, many healthcare providers just prescribe antibiotics without determining if the infection is bacterial or viral, leading to unnecessary antibiotic use that can actually complicate situations further. Understanding these fundamental ideas help us recognize why some common treatment approaches might not address the actual root cause of the recurring infections. In the next section, we're going to explore how we can work with your child's body to support that proper immune function, support drainage, rather than just treating the symptoms as they appear. Okay, we're going to jump into how your child's ear works and focus on key structures involved in ear infections. Understanding these parts will really help you see why infections develop and how we can prevent them. So, at the center of our discussion is the eustachian tube, or the ear canal. It's a really important passageway that connects the middle ear, which is the space behind the eardrum, to the back of our throat. The tube has 3 vital functions that keep your child's ears healthy. First, it balances the air pressure between the middle ear and the outside world, which prevents that uncomfortable feeling that you probably experience in an altitude change or something like that. Second, it allows fresh air from the outside to flow into the middle ear, which is essential for keeping all of those tissues healthy. And third, it creates a drainage path for fluid to flow from the middle ear down into the throat. The structure of the eustachian tube is really interesting, honestly. Part of it's made of rigid bone and the rest of it's made of a flexible cartilage. This combination allows the tube to stay closed most of the time, which protects the middle ear, but it'll open whenever we need to, such as when you swallow or yawn. And the movement of this tube is controlled by an intricate system of muscles and nerves. But the two main muscles that work together to open and close the tube are first one called the TVP, or tensor veli palantini, and that one is primarily responsible for opening the tube. The second muscle is the LVP, the levator veli palantini, which does both opening and closing of the tube. These muscles respond to signals from very important nerves that also control activities like swallowing or speaking. Another really crucial structure in this discussion is our adenoid tissue. Adenoids are small patches of tissue high back behind the nose, essentially right where the eustachian tube opens into the back of our throat. They're part of your child's immune system, and their location can sometimes cause problems. Children have relatively larger adenoids compared to adults, and when those tissues become even more swollen and large, they can block the eustachian tube opening into the back of our throat. When we look at kiddo ear infections, this becomes really important. So again, as we've talked about, kids' eustachian tubes lie more horizontally and are more narrow than adults. When you combine that with enlarged adenoids and the complex muscle and nerve interactions that may be interfered with, you can see why children might be more prone to have ear infections. But again, it's not just about the anatomy. The key to understanding ear infections lies in how all of these pieces work together. When the nervous system is functioning optimally, it promotes proper control of the muscles that open and close the tube, which allows for normal drainage and normal pressure regulation. When the system isn't working well, that's when we start to see problems with fluid buildup and the recurring infections. This understanding helps explain why some traditional treatments might only provide temporary relief instead of lasting relief. By addressing how the nervous system controls these structures and allows the ears to drain, we can work properly to restore that intended function rather than just treat the symptoms as they come up. All right, now that we understand the intricate anatomy of the ear, let's explore how chiropractic plays a vital role in helping your child's body maintain that proper ear drainage. Remember those important muscles that we discussed and those nerves as well. They're actually at the heart of why chiropractic can be so effective for ear infections, especially when it comes to promoting drainage to get rid of that fluid. When your child's nervous system is functioning optimally, it sends the correct signals to those muscles that control the eustachian tube, specifically that tensor veli palantini and levator veli palantini. And these muscles need to contract and relax at just the right times to open the tube during activities like swallowing and yawning, and then close it after. This movement allows for proper fluid drainage from that middle ear. However, there are various stressors that can interfere with this really intricate system. Anything from birth experiences and stress on their head and neck during the birth process, early childhood developmental patterns, or even day-to-day physical stressors can create tension in that upper neck region. This tension can affect how the nervous system communicates with those important ear muscles. When this communication is disrupted, those muscles may become too tight or just not function properly, and both of those things prevent the eustachian tube from opening and closing as it should, and therefore prevent that fluid drainage. Okay, I want to show you with a drawing to help you visualize what's happening, and so I hope you can see this. But here we have the outer ear, and then the middle ear with the eardrum and the middle ear. And so this is the eustachian tube that connects to the back of the throat. When fluid fills up behind the eardrum, it needs to drain through this tube. But if the muscles controlling the tube are not receiving proper nervous system signals, the fluid becomes trapped. So so it drains down the back of the throat, and there are the muscles that sit here along the tube, and then nerves that go and control those. And again, this is the ear and this is the eustachian tube. And so just so you can see that. And this stagnant fluid is what creates an environment for bacteria and viruses to thrive, leading to those recurrent ear infections that so many parents come into our office with. And so this is where chiropractic becomes crucial. Through gentle and very specific adjustments to that upper cervical spine, we help release the tension and stress on the nervous system. And you can think of it as restoring a clear communication between your child's brain and these important ear muscles through the function of these nerves. And so when this communication is restored, those muscles can function as they should, allowing the eustachian tube to open and close and that fluid to drain properly. I also just want to share a recent case that shows this beautifully that happened in our office not too long ago. There was a young patient that came in and she had 6 ear infections in 6 months. Their pediatrician was recommending tubes, had been on a ton of antibiotics, also recommending removing adenoids and tonsils. We used our really advanced scanning technology and identified areas where her nervous system was under stress and gave her a very specific care plan focused on those areas, and we were able to restore proper nervous system function. And her ear infections resolved and she was able to avoid tube surgery and removal entirely. The key difference to our approach is we're not just treating the symptoms, we're addressing why the ear infections keep happening in the first place. And through restoring that proper nervous system function, we help your child's body regain its natural ability to drain that fluid from the middle ear and down the throat. It's not just about stopping the current infection, it's about also preventing future ones by supporting your child's body to function exactly how it's designed and intended to. This is why we see a lot longer and lasting results with chiropractic care, because instead of creating artificial drainage through tubes or repeatedly just treating the single infection and not treating the fluid, we're helping your kid's body restore that natural drainage system. Okay, I want to take some time to discuss common medical approaches to treating those ear infections, focusing on antibiotics and ear tubes. This will help you understand the benefits, but also the limitations of these treatments. So to start, the CDC actually provides important guidelines about antibiotic use for ear infections. They recommend a more cautious approach than we often see practiced. Their guidelines suggest 2 primary strategies: watchful waiting and delayed prescribing. With watchful waiting, doctors observe the infection for 2 to 3 days before prescribing antibiotics, giving your child's immune system a chance to fight the infection naturally. And then delayed prescribing often gives you a prescription and suggests you wait a few days before filling it, as many infections can resolve on their own. Also taking into account many infections are viral as opposed to bacterial. However, what we have observed over the past handful of years tells a different story. Most children do receive antibiotics immediately, especially when infections are reoccurring. And while they are absolutely necessary in some cases, their frequent use does raise concerns that we need to understand and take into consideration. When antibiotics are used repeatedly, they can lead to bacterial resistance, meaning that these medications become less effective over time, over the course of their whole lifetime. Even more concerning is how they can impact your child's developing immune system and gut health. Antibiotics don't just target harmful bacteria, they also affect the beneficial bacteria that help your child fight infections naturally. Research has shown that children taking amoxicillin for ear infections actually experience 2 to 6 more times recurring ear infections, creating a challenging cycle. When antibiotics stop working effectively, the next recommendation is usually ear tubes. So let's talk about what all this involves. The standard approach starts with antibiotics clearing the immediate infection, but the crucial point is the antibiotics may address the bacterial infection if it is bacterial, but they don't solve the underlying drainage problem. The fluid remains trapped behind the eardrum in the eustachian tube because it's not able to drain properly. The brain and body are not able to send the signals to those muscles to drain it properly. To address this, what doctors do is surgically insert tubes through the eardrum. These tubes are designed to create airflow and help dry out the middle ear space. And often during the same surgery, doctors just go ahead and recommend removing adenoids and tonsils, especially if they're enlarged from the recurring ear infections, again, because they are immune tissue, so they will respond to infection. This is where I love to say we should need to take a pause and consider the broad implications as well. Your child's adenoids and tonsils are very important parts of their immune system, and they're actually your child's first line of defense against infections. And when we remove them, we're not just taking out the problematic tissue, we're also removing part of their natural immune system response. And this can lead to potential consequences down the road. Without these protective tissues, fluid can move more directly into the lungs, which is why we can see an increase in conditions like asthma and bronchitis in children who have had these surgeries. There's also recent research that suggests a more cautious approach when it comes to these surgeries. There was a 2021 study done by doctors Hoberman and Preciado that found no evidence that tube insertion actually reduces the number of ear infections children experience. This does raise an important question about whether or not we're addressing the root cause of the problem. And so, all of that being said, what we're learning is that these traditional treatments can provide temporary relief and may be necessary at some times. However, in the grand scheme of things, they don't address why your child keeps getting ear infections in the first place. They don't address the fluid and the drainage issue. This is why understanding the connection between your child's nervous system and ear drainage is so crucial, because it offers a different perspective on addressing those recurring ear infections. Okay, as we wrap up, I want to get to the best part for you today. I want to share some gentle and natural remedies that you can use at home to support your child's comfort and healing when it comes to ear infections. While these remedies complement professional care, they can also provide significant relief during those challenging moments when your little one is just so uncomfortable at home. And so the first one is natural ear drops. So mullein and garlic oil, they're both one of nature's most powerful combinations for ear health. So garlic isn't just for cooking, because it also contains antiviral and antimicrobial properties that help fight infection. When it's combined with mullein, which is a flower known for its anti-inflammatory benefits, it creates a gentle and very effective remedy. How you use it is you place anywhere from 2 to 4 drops in your child's affected ear while they lie on their side, and this can be repeated up to 3 times a day. The warmth of the drops provides immediate comfort, while the natural properties of those things work to support healing and reduce inflammation. Another thing is a soothing salt compress. So a warm compress provides significant relief to ear pain. Adding salt can enhance its therapeutic benefits. The salt draws out inflammation and can help normalize ear pressure as well. So how you make an effective compress is take a clean cotton sock, fill it with high quality and coarse sea salt, warm it gently, make sure it's not too hot, and then apply it to the outside of the ear. If you want to add a drop of lavender oil to the sack, that also has calming properties that can help soothe the ear as well. The next one is actually onion therapy. And so onions have been used for centuries to support ear health because they also have antibacterial and anti-inflammatory properties. So to create an onion poultice, slice an onion in half, warm it gently in a pan with a small amount of olive oil until it's soft. When it's cooled enough, wrap it in an unbleached, ideally cheesecloth, and apply it to the outer ear for 10 to 15 minutes. The natural compounds in the onion will reduce inflammation, and also the warmth will be really comforting. And then just supporting your kid's healing environment. So beyond these direct remedies for the ear, we can also support ear health through dietary considerations. For example, many children show sensitivity to conventional dairy products, which can increase mucus and inflammation in the body. And then the excess mucus makes it harder for the eustachian tubes to drain properly. So you can temporarily reduce dairy intake during active infections, or if your kid's prone to ear infections, and watch for improvements in ear health and just overall mucus production. And then a few things to keep in mind when you're using these remedies. Always test the temperature of any warm application before using it on your child. Observe your child's comfort level and response to each remedy so you know what works well for them. And then, of course, continue any professional care along with these supported measures that you've gotten from your care team. And then the biggest one is trust your instinct and your mom gut. You know best, and you're your child's best advocate. These natural supports can provide comfort and aid in healing, but they work best when they're part of a comprehensive approach to address the root cause of ear infections. So when you use these remedies, continue working with your healthcare providers, such as a pediatric chiropractor, to ensure that your child's ear infections are being properly addressed at the source and at the root cause. Now to wrap up on our time today, first of all, thank you so much for watching this through, and I hope it provides some valuable information and insight. And I just want you to feel empowered knowing there are natural and effective solutions to help your child's ear infections. You don't have to feel stuck in the cycle of antibiotics, and you don't have to watch your little one struggle with recurring ear infections. At Salt and Light Waco, we understand how stressful and overwhelming it can be when your child's dealing with chronic ear infections. That's why we're so committed to informing families, empowering them, and helping them find lasting solutions that address the root cause through gentle and really effective care. We have state-of-the-art nervous system scanning technology that allows us to identify exactly where stress and interference is affecting your child's natural drainage and immune function and overall function of their nervous system. This approach really helps us develop a scientific but also very personalized care plan that supports your child's body healing and functioning, as all care plans should. And so because we believe so strongly in helping families find relief from these chronic ear infections and other health struggles, we are offering a special opportunity for those watching this webinar. If you schedule your child's first appointment with us, you'll receive $80 off our comprehensive new patient evaluation, and that includes our advanced nervous system scans. This assessment will give us and you a clear picture of how your child's nervous system is functioning and how we can help restore that proper ear drainage. Your kiddo is precious, and your child deserves to experience life to the fullest without the burden of chronic ear infections and immune challenges. Whether you choose to work with us at Salt and Light Waco or find a pediatric chiropractor in your area, which we would be happy to help you with, taking action to address the root cause of ear infections really can make a profound difference in your child's happiness and overall health. So thank you so much for investing time to learn more about natural solutions for your child's ear infections and what we can offer through chiropractic care. If you have any questions, would like to schedule an appointment, would like a picture of that drawing, please reach out. Our mission is to help families feel and function to their fullest potential, and we'd be honored to be a part of your child's healing journey. Thank you.